Hey everyone, it's been quite the week. This video is not going to be as polished as my previous coronavirus, now COVID-19 videos have been, for a reason I'll discuss near the end. Today I'm focusing on updates just in the US because I don't have a great handle on what's happening on the ground anywhere else, and the rate of updates here has been accelerating. Though stories I've heard that have been coming out of northern Italy sound particularly horrific, I'll post a link to one or two in the comments below. So as you likely know, the number of confirmed COVID-19 cases in the US has climbed. A week ago, we had 60 cases. As of this recording, we are at 754 officially confirmed cases, including at least 43 in my home county of Santa Clara, some of whom are in our hospital at Stanford just a block away. But there's a big problem with these numbers. As much as the rest of the world was talking about severe underreporting of cases in China 6 weeks ago, we have an equally big problem here now. Because of the delay in getting widely available COVID-19 testing in the US, not just the majority, but the overwhelming majority of cases have not been identified. There is currently widespread community transmission occurring in most states. What this means is that any hope of containing the virus, keeping it limited to certain geographic regions, is gone. Now, what the United States needs to do is to switch from containment to mitigation. This is a bit of an oversimplification, but the primary goal of containment is to reduce the total number who are infected, while the primary goal of mitigation is to reduce the total number who are infected at the same time, meaning that a graph of new infections over time looks flatter. The area under the curve, that is the total number eventually infected before the outbreak is controlled, will hopefully be smaller with mitigation, but that's a secondary consideration. Why do we care about the shape of the curve? Because a significant number of cases will require hospitalization, and a significant number of those will require ICU level care, and we only have so many critical care beds. Estimates are around 100,000 such beds in the US. That sounds like a lot, except at any given time, the vast majority are already full of patients with things like heart attacks, strokes, pneumonia, liver failure, or just post-op patients after conventional heart surgery. Now, consider that in a month or two, we may have 1 million simultaneous COVID-19 patients, and those who are critically ill will require weeks of ventilator support before recovery. We're going to find ourselves short thousands upon thousands of ICU beds. This won't just affect patients with COVID-19, this will affect every critically ill patient. We will run out of ventilators, and even before that point, hospitals may run out of personal protective equipment, such as N95 masks, disposable gowns, and gloves. While the federal government has enormous stockpiles of this equipment for use in a pandemic like this one, there's speculation that it might not be enormous enough. And it's going to get really hard really quickly to get more such equipment when these masks and gowns are either produced in China or are produced in the US using raw materials from China. So going back to mitigation, the reasons we want to flatten the curve is so that not as many ICU beds are needed at once, to give us time to strengthen the supply chain of personal protective equipment, and to give us time to learn how to improve hospital operations in order to increase the number of ICU patients we can simultaneously care for. Mitigation will also give us time to study the effectiveness of antiviral drugs, and hopefully to develop a vaccine, which may be more than a year away from deployment. How do we mitigate a pandemic? It's all about hand washing and social distancing as discussed in the last video. Isolation of sick individuals, home quarantine of close contacts of sick individuals, working from home, canceling large group events, and even closing schools and daycare centers. Now that last one, that's particularly challenging. While canceling Maroon 5's US tour or in-person game attendance for the rest of the NBA season will be upsetting for many, it won't create a dilemma for millions of families. In contrast, closing schools and daycares will be huge. Now, I know a lot of people are out there thinking, kids may not get very sick from COVID-19 as a general rule, but they are important vectors for the disease spread, and therefore the safest thing is to keep them all home. That certainly sounds very logical. It feels very logical, and I understand people that reach that conclusion very quickly. But there are consequences to what seems like a very logical decision. For example, a lot of parents will need to continue working. In order to do so, they may look to grandparents to watch their children, the general demographic that is, by a large margin, at the highest risk of critical illness and death after catching the virus. Many children, particularly in urban areas, are homeless or otherwise live in poverty, and they rely on school-provided meals for nutrition. And of course, something that's close to me, about a quarter of the healthcare workforce has at least one child who is too young to stay home alone. If schools close, we'll see huge numbers of doctors and nurses taking leave at the exact time when they are needed most. Those workers who remain in hospitals left behind and who aren't already infected themselves will be working dangerously long hours and caring for a dangerously high number of patients, which again will impact everyone in the hospital, not just those with COVID-19. We've discussed some interesting solutions to this problem at Stanford if things got really bad, such as doctors remotely rounding on their inpatients via video conference from home. Everyone is keeping their fingers crossed it doesn't come to that. So when it comes to closing public schools, to be honest, I don't know what the right solution is. But whether it's a good or a bad idea, I think our local schools here in Santa Clara County, I think they're going to shut down soon. And once one district pulls a trigger on closure, every other district in the San Francisco Bay Area will feel enormous public pressure to do so. And those that do close, they may stay closed for a long time, like possibly the rest of the school year. And summer camps might be canceled. We could end up with a 6-month period during which families with young children will only have one parent able to work full time, which is going to present a huge economic and financial burden for so many people. It's kind of hard to overstate the problem this is going to lead to. So, in summary, if you are young, healthy, childless, or already work from home, and you don't have any elderly relatives whose health you need to worry about, you may sail through this crisis unscathed. But for the country as a whole, including our healthcare system, I think things are going to get bad, like really bad. So now, what are specific things that you as an individual can do to help mitigate the pandemic? Number 1, wash your hands frequently. While using an alcohol-based hand sanitizer is better than nothing, plain old soap and water is better than sanitizer for preventing transmission of COVID-19. Number 2, stop shaking people's hands. I don't really understand why handshakes are even a thing in 2020. Number 3, don't go to large gatherings. Even if that concert or sporting event or festival isn't canceled, stay home. Even events like movie showings and church services, I think twice about, particularly if you're elderly or have chronic illness. 4, if you're planning on hosting a gathering yourself, whether a child's birthday party or your monthly book club, consider holding off. 5, avoid unnecessary travel, particularly cruises. Work from home if possible. Don't go to work sick, which I know is easier said than done for many, many people. Number 8, if you are an employer, don't be an asshole. Okay, let your employees stay home sick without threatening to fire them or forcing them to find their own coverage. You do not want your restaurant or your retail store to become infamous for being a COVID-19 hotspot because you refuse to let your coughing cashier go home early. And number 9, if you think you might have COVID-19 yourself, and you are relatively young, and if your symptoms are relatively mild, meaning you only have fever and or cough, and do not have shortness of breath, stay home. Do not come to the emergency room or your primary care clinic. They are either being overwhelmed or shortly will be, and you will potentially expose lots of other people to the virus. Instead, call your primary care doctor or call your local health department to see if there are options for getting tested that won't require you to risk others. There may not be, but if there are, you should take them up on it. However, if your symptoms are moderate to severe, such as you are experiencing shortness of breath or you are elderly, do seek urgent medical attention. So in summary, if you need urgent medical care, go to the hospital. If you're only needing to be tested, first look for other options. I'm now going to get to why this video is a little less polished, which will also sort of be an update about this channel more generally. Some of you may have already heard that effective as of today, Stanford University is no longer holding in-person classes. While the campus is generally still open, all classes are to be held remotely, and all exams are now take-home exams. This is only definite for the last 2 weeks of winter quarter, but all of us faculty are working on the assumption that it will continue into spring quarter. So now, a small group of us have 3 weeks to figure out how to deliver 80 plus hours of curricular time on the practice of medicine to over 100 medical and PA students remotely. And that's in addition to staying on top of changes in our hospital's operations and general clinical practice due to the pandemic. And of course, it's on top of caring for these patients. So needless to say, I'm going to be really, really busy for a while. I will try to put out videos here on YouTube as often as I can, but it will not be at the same rate as previously. I hope you'll be patient and stick around. There is so much more medicine I'm looking forward to talking to you about. Anyway, that's it for today. Stay safe, wash your hands, don't go to work sick, and hope that every epidemiologist in the world is wrong about this.